My name is Casey Overstreet, and this is my Persuasive Speech. Addiction is a choice, and addicts are a burden to our society. This was the mindset for far too long. Even today, people in our community still carry that same mindset. Substance use disorder is a chronic disease, and those who struggle with it deserve compassion and dignity. What we will explore in this speech will bring the audience to understand the disease of addiction and why it is imperative to show compassion and dignity to those with substance use disorder. I have personal experience with addiction, and I am currently pursuing a degree in psychology to become a licensed alcohol and drug counselor. I will discuss two main points. First, addiction is a chronic disease and not a moral failing, and second, why compassion and dignity are deserved by those with substance use disorder. In Tim Holden's 2012 letter in the Canadian Medical Association Journal, he states that a cancer patient would not be cured of their disease if they were locked in a cell, whereas an alcoholic would automatically be cured. And that medicalizing addiction has not led to any management advances at the individual level. You may be thinking, but these statements are from 2012. Times have changed and we no longer view addiction in this way. Most of the medical community does not view addiction in this way anymore, but everyday people like you and me in communities all across America still view addiction as a moral failing. We will start here and now to change the attitudes and beliefs of substance use disorder as being a moral failing and begin to see it for what it is, which is a chronic disease. Indiana University Health says that addiction rewires the brain structure, it hacks into your brain's communication system, and interferes with how nerve cells send, receive, and process information. This is exactly why people who struggle with addiction cannot stop drug use even when they are facing severe adverse events in their lives. The National Institute on Drug Abuse in July 2020 says that addiction is a lot like other diseases, even comparing it to heart disease. They both disrupt normal, healthy functioning of bodily organs. They both have serious harmful effects, and if left untreated, they both can last a lifetime and even lead to death. I have a brain imaging scan from the National Institute on Drug Abuse website that was from the Surgeon General's report on alcohol, drugs, and health. It shows a normal, healthy brain, a brain 1 month after using cocaine, and a brain 4 months after using cocaine. This imaging shows physical changes in the brain that are critical to judgment, decision-making, learning, memory, and even behavioral control. According to the National Institute on Drug Abuse, these changes in the brain help us to understand the compulsive nature of addiction. Even 4 months after using cocaine, the individual's brain has not returned to normal dopamine levels, showing why the craving for drug addiction is so strong. It urges the individual to get and use more drugs, seeing that there are physical changes in the brain caused by abusing substances, and those changes rewire the person to seek out substances so that they can keep their brain dopamine at a normal level. And the brain will do everything in its power to achieve the drug, even when the individual does not want to continue. This is why addiction is a chronic disease. This research study on the brain in people with substance use disorder directly contradicts the statements of Tim Holden and the attitudes of those who believe that addiction is a moral failing. Now that we understand how addiction is a disease and not a moral failing of willpower, we can explore why it is important to have compassion and extend dignity to those with substance use disorder. The Centers for Disease Control on January 31st, 2025 stated that substance use disorder is treatable chronic disease. Make no mistake, substance use disorder does not discriminate. It does not matter who you are, where you're from, or what position you hold. Addiction has a long reach and touches the lives of people who would have never imagined struggling with addiction. A treatable chronic disease. Treatable being the key word. Then what causes those with substance use disorder to not seek out the help or treatment that they need for their disease? That's stigma. People who show no compassion, no empathy for the person behind the addiction. People who disregard human dignity because their mind only focuses on what the person has, which is addiction, and not who the person is underneath the disease. Chronic disease is how the CDC classifies substance use disorder. So why are people with substance use disorder still viewed as unwanted by society? Would we treat someone with a different chronic disease in the same way? I don't think we would. You would not look at someone with diabetes and think to yourself that they are dirty for having the disease. Diabetes requires ongoing management, just as substance use disorder does. And relapse happens in someone with diabetes, just as it does with someone with substance use disorder. We're not going to shame a diabetic for needing insulin, so why are people with substance use disorder shamed for living with the disease of addiction or needing treatment for it? When people with substance use disorder know their fellow humans extend compassion towards them and they're treated with dignity, then they can find safety and acceptance and reach out for the help that they desperately need. Addiction physically rewires the brain's regions where judgment, decision-making, learning, memory, and behavioral control are located. Because of the studies done on the brain in those who have abused substances, addiction is classified as a chronic disease. Knowing that addiction is a chronic disease that so many people suffer from on a daily basis gives us the mindset to have understanding. This is all a domino effect. When they are treated the way that they should be by society, they can feel safe enough to reach out for help. Knowing all that we discussed, I am challenging you to view those who struggle with addiction as people first. See who they are when they no longer suffer from the disease of addiction. Extend compassion. Treat them as dignified human beings who deserve to be seen. And open a safe space for people with substance use disorder to reach out for help without the fear of being stigmatized.